Good afternoon, everybody. Welcome to the third episode of Barcelona BHH series. My name is Aline, and I'm the Chief International Officer of Barcelona Health Hub. So today we're going to talk about mental health. So how to stay mentally healthy in a situation like we are at the moment. So we're going to talk about confinement, about working from home, like being connected to your team, about mental health in general, but the healthcare workers, etc. And today, to talk about this topic, I'm accompanied by 4 experts in the field. So we've got Pablo, the VP and General Manager of Health at Headspace, Alberto, CEO of Wemby, Ricardo, Chief Medical Officer of Sayus, and Manuel, the founder director of CAT Barcelona. So I'm gonna ask each of you to present yourself briefly. So tell us like who you are, what your company is doing, and briefly what you've been doing those past weeks in the context of the COVID-19. Pablo, do you wanna start?
Sure, and thank you, Aline, for the invitation. I'm so glad I can join, since originally I'm from Barcelona, but now I'm based in the US in California. I'm at Headspace, where I lead the healthcare business, and within Headspace, Headspace is the lead science-based mindfulness solution. So we have over 63 million people in 190 countries, 25 peer-reviewed published studies, and then we have 3 businesses: the consumer business and direct-to-consumer, the B2B business, where we are offering Headspace to employers. We have over 650 companies offering Headspace, some of the biggest Fortune 500 companies. And then the third business is the healthcare business, the one that I'm at. And because of COVID, mainly we did 2 things. So one is offering some of our most used content for stress and anxiety, and also for sleep, and make it available for free. So we're a subscription business, but we made some of our content available, a pack called Weather in the Storm. So all of you can go to the App Store, you can download app or Google Play, and download the app, and you can use the content. And from the healthcare side, what we did, it's offering full access to Headspace to all the healthcare professionals in the US until the end of the year. Free access to all our content, over 1,000 hours of content, and we also did this with the NHS in the UK.
Perfect. Wemby?
Hi, I'm Alberto, the founder and CEO of Wemby, and Wemby provides online counseling and mental health coaching to people, organizations. During these times, what we are trying to do is to put together an offering for medical professionals to receive online counseling for free. So we already start to mobilize our own team, and we are expanding with a team of volunteers to provide hours of counseling to hospitals, clinics, and nurses and doctors, people being on the front line of this epidemic. So Wemby, we specialize for caring for the carer. So provide services initially for NGOs, and we are expanding as well with corporates, law firms, and service providers at large. Our expertise is generally like giving help to those in the most difficult situations.
Okay, fantastic. Sayus?
Hi, I am Ricardo, and I am a psychiatrist. I did medical school in Barcelona and then moved to the UK in 1998 to train as a psychiatrist there. I did my clinical training at the Maudsley, and I got a master's in research methods in psychiatry and a PhD in neuroscience at King's College. And I worked as a forensic consultant psychiatrist in the NHS for 17 years until 2016, when I moved to industry. I worked for a pharmaceutical company as a European medical manager for neurology and psychiatry for 3 years. And I joined Sayus in October last year as the chief medical officer. Sayus is a company that specializes in creating virtual reality environments that are presented in a platform like a subscription service and are used as tools by psychologists and mental health professionals. We when the pandemic hit us, we realized that there were two main difficulties that we were facing. The first one was the infection risk posed by sharing the virtual reality equipment, and the second one was the distancing between patients and physicians. So we decided to prioritize those two, and we focus on patients first. So first thing we did is to create a Android app called Sius at Home that allows the patient to connect to the patient's platform remotely. Very similar to what Headspace done, we have also offered two free content, one for mindfulness and one for relaxation in the app. With that in mind and solving the problem of mental health patients accessing services, we then thought about a clinical network. We received petitions from a psychologist that wanted to help but didn't know how. And we identified that the main point of need at that point was the frontline healthcare workers. So we created two patient support programs, Cuídate en Casa and Stay Strong at Home, by which we are offering 1,000 therapy sessions for free to healthcare professionals through this. And then we decided to focus on the third aspect of the confinement, which is what do you do when you're at home. And we've launched 3 clinical networks, one in Spain, another one in UK and the US, and a third one in Latin America. And we are delivering training sessions in the form of webinar to a psychologist, and our clinical network psychologist is also doing training sessions for the public in general. So this is what we're doing.
Fantastic.
And we've done that in 2.5 weeks.
Wow. Manuel, do you want to tell us about you?
Thank you for inviting me, Aline. My name is Manuel Masbaga. I work as a psychiatrist. I studied in Universitat of Navarra, and after my specialty was in Barcelona and later in Yale University in the Connecticut Mental Health Center. I'm running 3 clinics I founded in 1986, specialized in mental health. We started in addiction, but after we run programs of obsessive compulsive problem with schizophrenia, with dual diagnosis, and most of the mental health problems in adolescents and basically adults. We are running in terms of rational emotive behavioral therapy. It's a cognitive intervention. We are supervisor of the Albert Ellis Institute, so we are very in touch with this institution. And we introduce for parents and for families since the confinement tools for working and to maintain the treatment. We have 90 beds, so the people who are in touch with us and as patients are very vulnerable, and so we have to continue working with them and with their families. So we know that this epidemic is increasing the stress, the anxiety, the depression, not in all the general population, but in our patients. So we have to have a 50% of the team in presential and 50% at home, and manage the individual therapy, the group therapy, all the intervention, taking part on the different pharmacology. So working these weeks to maintain the contact with the patient, but at the same time to care for all the professionals that are in the front line in our team.
Exactly. Okay. Well, thank you very much, everybody, for those short presentation. So first, I would like to talk about confinements. So here in Spain, we've been confined for more than 3 weeks already, and they just announced that we're going to be confined a couple more weeks. So it's accumulating. It's not always easy, like to be at home, and a lot of people are alone. You have also to manage like all the anxiety coming from all sides, like all the news coming from outside for what's happening in the hospital or to your family, etc. So I think it would be nice to talk a bit about like concrete actions, like all the people who are listening today. what can they do? What can we do at home to make the most of that time? So I remind you that we've got the chat. So if you want to ask a question to the speakers, or if you want to make a comment about the topic, you can do it in the chat, and we're going to pick the question and address them during this hour. Try to address most of them if we can. So first, let's talk about mindfulness. So I think that's something that's maybe less known here in Europe, for instance, than in Asia. Like Pablo, Headspace is like a mindfulness app. Can you tell us more about what is mindfulness and how can we use it at the moment in this confinement period?
Sure. Yeah, like you said, it's well known in Asia, and we started 10 years ago, actually, in the UK. Our two founders are a former Buddhist monk and a former media exec. So Andy, the former Buddhist monk and the voice of Headspace, he started in an integrative medicine clinic in the UK. And then Rich, the CEO of Headspace, was his patient. So, and actually experiencing the effects of mindfulness himself, he was extremely stressed and living with anxiety. Then he wanted other people to experience the same thing. And again, over the years now, 10 years since we launched Headspace, well, it's been proven the effect of mindfulness in terms of stress reduction, anxiety, increase. In our case, we also have evidence in terms of increasing compassion, increasing focus. Just for one session of Headspace, for example, increases the focus by 14%, increase in happiness, reduction in depression symptoms. Also in the workplace, I know that now we live in a kind of a weird moment where we work from home, but definitely all these are the effects of mindfulness. And when people talk about mindfulness, of course, it's meditation, but it's also beyond meditation. In our case, we started with meditation, but we have a lot of content in sleep now, and a lot of our users come for the sleep content, help you to sleep. And we have specific content also for insomnia and MBTI course, as well as content for, mindful walking, mindful, again, now weird times, but mindful eating. So it's about, being present and thinking and what you're doing, and just let your thoughts come and go rather than sticking with the thought. But I just want to say I'm not a clinician myself, so definitely maybe Ricardo, you can go on the or Manuel, you can go on the clinical side.
But maybe Pablo, before moving, can you tell us, like, if people wanted to use Headspace today, how many times a day, how long, how does it work?
Good question. I think all our studies are based in at least 10 minutes. We recommend 10 minutes every day, whatever, if it's, in the morning ideally, but whenever you have a moment. But 10 minutes, at least 3 times a week, you can see the effects. And way better if you don't have the time, if you think, hey, I'm busy to do this, way better to just do, we have even 5-minute meditation or 1-minute exercise to focus. And so it's better to do, even if it's just 1 minute or 3 minutes every day, rather than we have up to 20 minutes for the ones that are more used to mindfulness, and way better to do 5 minutes every day than 20 minutes, 1 day a week.
Okay, great. Ricardo, do you want to comment on that? Because I know you're also offering mindfulness through the device, like the Psarius device, the VR. You need to unmute yourself. We can't hear you.
Yeah, sorry about this. Yeah. We do have environments for mindfulness, and I don't think I can add a lot to what Alberto has already said. There is a page, if anybody is interested in checking the NIH, the National Institute of Health. It's the National Center for Complementary and Integrative Health. I can send you the link through the chat, and in there you've got a repository of the scientific evidence that backs up mindfulness as a therapeutic tool. I would say 2 things, which is sort of stressing a couple of points that Alberto has already said. The first one is that it's safe. It's considered to be safe for healthy people, so there are very little risks involved. And also that is a habit, is a mindset. It's not an intervention that will deliver a solution to your problem immediately. It's a way of training your brain into achieving a state of wellness that will permeate in every activity that you do. So you can find peace when you're eating, you can find peace when you're walking, or you can find peace when you're shopping or when you're dealing with your kids. In SIOS, with a mindfulness environment, we put them there with the idea that people will use them to meditate. But what we've seen is a tremendous uptake transdiagnostically. So we have a group of psychologists that work on psychological rehabilitation. And these people are working with patient population as varied as oncology patients or pediatric populations undergoing lumbar puncture. And what they've seen is an improvement of anxiety and depressive symptoms and an improvement in the post-operative state. So they recover quicker and and faster than if they are not exposed to mindfulness. So it really is a fantastic tool, and half the sessions that we deliver in our platform are mindfulness sessions. So really, really useful.
Okay, fantastic. Also, so question for all of you
Yes, an appointment. I agree with both of you. We highly recommend mindfulness. In fact, we have integrated as a tool in our patients, both in the residential, in our patients. So I think it is very important, very interesting for people like attention deficit hyperactivity. Recall disturbed is very interesting. We are using Research Into Yourself, Davidson and Goleman, but it's mostly like Ricardo. And I think that for people, just for adolescents and for personality disorders too, it's working very well. So even 5 minutes or 10 minutes and doing at home or connected with the people is good. We are now doing yoga by internet too. We have a person outside that's doing it. It's great. And the people connect very much at this moment. No? So they are able to continue working with themselves. It's not the same as mindfulness, like meditation, but it's part of the program more than cognitive or behavioral or emotional tools.
Perfect. So when we started the confinement a few weeks ago, some specialists were insisting on the importance of having a routine. Can you comment a bit on that?
Sorry, go Manuel.
No, just for starting, I think the schedule during the confinement is very important. We have seen in our patients that we have to continue the structure from 8 in the morning to 6 in the evening, and they manage much better than during the weekends, that there is no so much structure. So people on confinement, we recommend a structure, meaning time for reading, time for being with the family, time for wake up, time for TV. Someone, but not especially in this way, and maintain these routines during the day, even 7 days a week. I think this is one of the good points. And introducing, as we said before, mindfulness as a part and physical exercise at home is possible too. And nutrition for preventing eating disorders, that will be some of the tools we can discuss, just for introducing.
Okay.
Manuel is very interesting. I just wanted to add, as an entrepreneur, being confined in myself, I can say what keeps me going is a pretty straight routine that includes as well. I'm an avid yoga practitioner and a meditator since like many years. So I definitely can relate with what you're commenting.
Fantastic.
I actually have a list of things that I wrote down for this. So the first thing that I would say is don't panic. right. We don't make good decisions when we are in panic mode. There are cognitive bias that play a role when we're panicking. Don't have fear either, because you might be able to make some good decisions, but by the majority of them will not be very, very, very good. The best thing to is just keep calm, and be mindful that what we are dealing with is a transitory aggression from the environment. It's lethal, it's dangerous, be respectful with it, and be careful. But don't let fear or panic cloud your decisions. The second thing is about information. One important thing, and we keep having this contradictory information from everywhere. And I think the important thing is to focus on practical information. When is the state of alarm going to be lifted? When can I go? Can I travel to see my mom who's unwell? Can I travel to buy things? Just focus on those practical bits of information. The next thing is about modeling. If you're calm, if you act coherently, and if you make good decisions, you are modeling that behavior to the people that you're living with. And this is particularly relevant for us with young children. If your children see you panicking, they are going to panic, and the whole thing is going to escalate. So just model that behavior. Routine, I agree entirely. It's very good to keep a routine that includes exercise and good nutritional habits. But it's also important not to be very strict with your routine, because these are not normal circumstances. You have to be a little bit flexible. You have to allow for your children to misbehave from time to time. You have to allow maybe not to wake up every day at 7:30. One day you might want to lie until 9. Do it, because these are not normal circumstances. Keep the communication open and connect with people. We used to have all these Instagram and Facebook groups and Telegram groups and all that sort of things to connect with people that were not related to our day-to-day lives. And those people have now been removed. So use those channels to connect to these people. Don't follow Arnold Schwarzenegger. I mean, he's a great guy, but at the moment, I'd rather follow my brother than Arnold Schwarzenegger. There will be a time in which I will hook up with Arnie again. But for now, I just keep a very close contact with the people I used to be every day with. And the last two things is keep up the hope. Just send messages of hope. This is going to end. It's not going to last forever. We're going to come out with a lot of new learnings and a new teaching, having known your partner and your children, knowing the strengths and the weaknesses, having taught things, learned things from them. And the last thing, which I think is very, very important, is try to help somebody. I mean, we are isolated, but doing things like this, participating in a webinar, sharing your knowledge, sending a message, asking whether anybody needs your help, it will make you feel that you're contributing to something. So those are my tips for sort of
Fantastic.
this period of confinement. Yeah.
Thank you. Pablo, do you want to add something maybe?
Go ahead, Pablo.
No, go Alberto, please, go.
Okay, thank you. No, just wanted to quickly add on Ricardo. This talk is quite exhaustive. Is a focus on what you can control. We are in a situation in which most of the things we used to be under control are not. They moved them beyond our aspect of control, and this must generate frustration. But if we focus on what we can control, we can reduce this frustration and basically get back and operate in a different way in our everyday life. Keeping in mind, as Ricardo said, that is also is going to pass, and is impermanent, like basically everything in this world. So please, Pablo, go ahead. I just wanted to add this little comment.
No, I couldn't agree more with what you both said. But I just want to reinforce one thing that previously both Manuel and Ricardo said. I think it's about, and this is coming back to the integrative medicine approach. So it's not just, hey, meditate and that's it. So it's about, hey, meditate and doing whatever, yoga exercises or small exercises at home, which is really some content for, a movement content that you can also do at your home, and then mindful eating. So it's just kind of all the aspect, this holistic and integrative approach. It's not just about, hey, no, if I meditate, 10 minutes, then that's it. I'm good to go. No, it's about training your brain. rather than and with all the different elements.
Exactly. Yeah, I agree with that.
Just one point. According to Martin Seligman, the founder of positive psychology, 40% of our happiness depend of us, not the activating events, not the COVID and at this moment. So we have a lot of opportunities to work with our emotions and with these different tools we are tailing, improve our happiness. I think it's very important. We have the opportunity to work on with on these emotions, no? And I would say that what we don't have to do is take analgesics in terms of drugs or alcohol, or stay in TV series for hours and hours. I think this was our points that are against this confinement. So we are talking about tools, positive tools, and negative tools, tools that are good for adapting to this scenario. That is, as we said, in cognitive approach, is not the end of the world, even that it looks like it's 100% negative, but not 150%. So disputing our irrational beliefs is part of the work we have to do with us, with our families, with our friends. I agree very much with staying in touch with the different WhatsApp group and whatever.
Absolutely, yeah. Ricardo, something you mentioned before, you mentioned the kids. Mm-hmm. So now the situation is that a lot of people, or most of us, are working from home. So you're confined with the whole family. You have to combine working with, you have to take care of the kids that they don't really understand what's happening. Some have very young kids. How can you combine all of that? What tips can you give to people who are at home?
Well, it really depends on the age of your children. If you have very young children, children under the age of 6, it will be very difficult for them to understand what's happening. So the main thing that you could do is keep them distracted and find them something useful other than the television to do. Change activity frequently so they are entertained. And if you have a balcony or if you have some outdoor space, allow them to go and play out there. If you don't, then you can do it. But it's going to be difficult with toddlers. With pre-adolescents, teens, it's easier. Most of schools have set up distance learning programs, and from 9 till 3 or from 9 till 4, at least my children are engaged in Google Meets and Google Classrooms, and they have their homework and they have a structure to the day. It's in the afternoon where I have to take over, and maybe I have to do some exercise with them, or I have to cook, or to do some activity together. So I think it depends on your family structure and depends on the age of your children as well. But the most important thing is what I said earlier. I think for me the important part is to model to them that this is not a panic situation. That is something temporary and it will pass, and ask them to get into a mind frame in which you look for opportunities rather than to focus on the negative. So, my children, one of them wants to learn to cook, and the other one has, with friends, had started a knitting group. These are skills that they didn't have, and you can buy all this in Amazon. Deliveries are still working. So there's plenty of things that you can do with them.
Fantastic. Alberto, do you want to comment on that, maybe? From your experience at Wemby?
Yeah, so I don't have small kids, so yet at least. And we provided a webinar just last week on dealing with small kids, especially for one of our clients. And it had a pretty positive reception. And it was requested, as one of the key things of learning how to do during confinement, especially the challenge of working, having small kids at home. It changes completely the environment. It creates distractions. and obviously like this adds an additional layer of stress, no? To the parents. They just still need to keep going with the job, and getting things done. So I'm not going to get in depth into what it was recommended. Like we got 2 psychiatrists here for that. No, but basically is balance. Is trying to find our balance, if it's possible, getting a place within the house that is for work, and trying to keep that separate. Not everybody has this option. One of my advisors was commenting that she used to work for a large accounting firm, no? And there is a big difference if you're a partner and you have a comfortable accommodation and you do a team meeting with another 50 colleagues. Then you got the trainees and the more junior people that perhaps live in a share flat. They don't have different locations to work, to be in private, no? So do what you have, and trying to deal as well with the kids. I think is a very good moment to take out that video, no, of I think it was the CNN a journalist that had their kids breaking into the meeting room, no? Like he was giving the code from his house, going viral. I think that is quite an example of how we can just take it the way it is as a situation in which we are right now, no? So, and another request that we are having, for example, like is dealing with the partners. So we live with our partners, and but still we're not 24/7, because our life as well that is happening around. But now is different. It's 24/7. The conflicts, the space. There's not any more separation. So this is some of other requests that we're getting from our clients on topics they need support on, or as well dealing with teenagers. This is a particular space for kids. I don't know if Riccardo, you want to add on that, since I got to understand that you might be target group.
Yeah, I think the management of conflict is a really, really interesting topic in this situation. I only have, the only thing I would say about this is, if the conflict is transitory, so you're annoyed with your kid, or you're annoyed with your partner for something that he or she or they have done, the best thing is not to react in a knee-jerk fashion. Just keep your calmness and say to the person, I don't like what you just done because of this, and I want us to take some time to think about this, and then we'll come back and discuss about this. So avoid heated arguments. This is not the time to have them. And my kids go to their room and I go to mine, and then we meet in the kitchen and said, do you understand why I was annoyed? And they say, yeah, what could you have done differently? And then you discuss the situation with less intensity. The other conflict that you were mentioned, the conflict with your partners, this might be the time to reflect on whether life with that person is what you want to do. But it's probably not the time to bring this up, because you can't go anywhere. I'm not saying forget it. I'm saying pack it, elaborate a structure, write it down. And when this finishes and you're out and about, you say to your partner, actually, during these 2 months that we've been confined, there's a few things that have occurred to me that I want to discuss with you, and bring up the conversation then, because now is not the time. So those would be my advice. I don't know if Manuel, as a psychiatrist, would like to add something to this as well.
Wouldn't the actual situation with provoking those behaviors or reactions, and in normal situation it wouldn't happen?
Say that again.
Like you say, like if a conflict happens with someone,
yeah,
in a normal situation it wouldn't happen. It's just the fact that we're in confinement, and with the situation happening, that provokes the situation.
Exactly. So we have, we need to understand that now we have time that we didn't have before, right? We don't have to commute. We don't have to rush to things. It's all in here. So the rhythm of life has changed. We need to adapt to this new rhythm. So that means taking things it's going to take a longer, I mean, even menial tasks like cleaning your house, you can spend the whole day and make sure that you do a really good job and enjoy spending the whole day, because you don't have to rush out to go to the countryside at 11. So the circumstances have changed. Those circumstances are imposing a different rhythm to us, and the way we reacted to conflict before cannot apply it entirely exactly the same in this situation. You have to adapt the way you react to conflict before to the circumstances that you're now. So there is your reaction have to be appropriate to your environment.
Yes, I would agree. And as we know, the anger in the conflicts or the projecting the frustrations through others is part of daily basis in clinic, but in family too. I have my son have 28 and twins of 22, so I can manage with him and with them, and I think the problem sometimes is the intrafamiliar violence we can see in the clinic and in a small phase in maybe in our families, but in general, gender violence or adolescents with parents, and this a real problem, because sometimes they feel that they cannot manage, and some of them can be in medication, but in four walls are difficult to manage, and so is a way to maybe telemedicine, stay in touch, to ask for help, even by phone, even by internet, is a good way too, because we can consider that stay in touch with our friends, as we said before, and try to manage intra-family the situation, but look for professionals too. It's a good way, because sometimes it happened to us that people was scared about the infection and take their children or their adults at home instead of the clinic, and they are having a lot of problems. They are not able to manage the situation. No? But working in family therapies, we are doing family therapies too, or doing group therapies, connecting with different peoples, could be a good way, even in these moments, to manage the situations. And pharmacology too. Sometimes we need pharmacology, and one of the problems is abusing, again, as we said, alcohol or drug or abusing medication. But sometimes it's okay to work with the different professionals and increase, if it's necessary, pharmacology, or reduce or stop for preventing these situations.
Perfect. I'm going to take a few questions from the audience now. So one question is about, we talked about mindfulness before. So mindfulness is just one way of relaxation. But like, how can you compare the pro and the cons of the different relaxation methods? And if you don't know about mindfulness or meditation, as we mentioned before, it's not so common here in Europe. That's maybe a different meaning than in Asia. How would people know what's good for them if maybe the right thing for them? Pablo, maybe you want to start?
Sure. The first thing I would say is, and I think Ricardo kind of mentioned this, but there is no risk on meditation. So I recommend it, but at the same time, meditation is not for everybody. So I will recommend just trying meditation just a few minutes, and starting with not go very specific into whatever tool you use, Headspace or others, but don't go, if you're new to meditation, we have like basic packs, or go through really understanding what is meditation, what this is for. And then the most important thing, it's like, let's not get obsessed if you're doing it right, or you're going to see the effects after doing it for a while, for a few days. So don't obsess with, hey, I'm doing it right. go with it, and whatever setting works for you. I mean, in the morning it's ideal, but for example, I don't do it in the morning. For me, works better in the evening. So it really depends on whatever your routine is and whatever works best for you. But just again, there is no risk of trying meditation. But whenever you're doing it, I think it's important that you have to be kind of in a quiet space. You have to be in the right mindset. You have to be kind of in the right position, and then give it a try. Of course, it's not just about closing your eyes and keep thinking about, oh, what's going on, or just keep listening to TV. It's just about doing the exercise, but don't get obsessed of, am I doing it right or not? I have a lot of friends new to meditation that it's like, I don't know if, no, just, it's about learning techniques. And for us, even, there are a lot of people that you've used Headspace for a while, and now they meditate themselves, and that's fine. So I just want to make sure that whatever works best for you, and there is no risk. This is the beauty of meditation versus, other solutions.
Manuel, maybe do you have other relaxation techniques that you recommend your patients that you can share with us?
I can tell you, basically we use meditation and I agree, reducing the stress of the people through this tool. And it's very important. And the question is, we have different people with highly and difficult mental health problems, but even for them, mindfulness is a great tool. That's the question, because sometimes there are more sophisticated tools but doesn't work. No, I think in the future the devices they are developing, and maybe we can talk about this. I think they are very interesting for the near future or just in the future. We basically nowadays we are introducing the mindfulness for 1 year, 2 years before. We're working with executives, and this is very good, because if we understand now the economical issues around the actual crisis, they need, and we are working with them in the business schools, because they need to prevent their burnout. The same as in the health care givers. The statistics now say in the field of healthcare that 50% now is on depression. They connected the front line, and with anxiety and insomnia and distress. So it's basically the good focus for mindfulness. So I would say that for all the populations, maybe some kind of schizophrenic, but even with them we have good results. I would say it's very useful, more than the cognitive and interventions and the as we said, emotional interventions and behavioral interventions and pharmacology.
Okay. So I have two other questions that are quite related about working from home. So the situation at the moment is that people are working from home, like the team are just like spread around, everybody in their houses. So what can the companies do to have the employees to stay mentally healthy during this period? So do you have maybe like tips to share with the employers?
So if you want, I can add something on this. Wemby basically is a distributed company from day one, and we got staff in Madrid, in the UK, France, in Mexico, and in Argentina. So we're a little bit spread around, no? Our best practices generally is communication. Is maintaining a communication channel open, not in a way that, it oversaturated and people feel like they're always on, but be available as much as is possible for your colleagues. Maybe they want, to have a virtual coffee. The Swedish called a kiffan, if I'm not mistaken. And a friend of mine that has a similar activity in the States, for example, they use an iPad now. Each of the staff members have an iPad sitting next to their laptop, and it is always on, and they're always in a virtual room. So the cameras are off, But in the moment in which somebody wants to talk to you, they just ping you and say, hey, you know, Alina, can you chat 5 minutes? And you just turn on the camera and the mic. So it gives that impression that you're not alone, that your team members are there, even if you're not. No? And one of the comments that we receive from some clients that are having difficulties adopting this new type of work setting is the vast increase in meetings. No? Obviously, in meetings, messages, communications, people feel like they're spending 10 hours a day on the phone. They're basically not stopping, you know, and as well is perhaps of use having your boundaries. So maybe like training your team on having the boundaries. That, you know, it's okay as well, like being there for your colleagues, but if you feel that, you know, you cannot pour from an empty cup, if you feel that your cup is filling up, as well going back to work and say, you know, I'm doing a piece of work right now, and I do communication from a certain time, or like that's a slot in which I'm more available. No? So if is it possible, let's try to communicate within certain set time of hours. The reality is there are several formulas, and the one that works best, it really depends on the DNA of each organization.
Yeah, I wanna add on that. What we do that it's working really good. And again, I know this is kind of in California, it's a different style. It's way more kind of based on objectives rather than how many hours you work. But what we do, it's two things. So one is when this started, we just look at our schedules, everyone being mindful of, hey, how is our life? So for example, now, and in one case is some people on the team, I cannot start working until 10 because I need to be with my kids, or like Ricardo said, maybe in the afternoon I need to be in the kids. So just respect this, and whatever time schedule work best for everybody, because if not, again, if your kids are, you know, right here, and again, this is depending on every situation, but if you can just work around, you know, the schedules of everybody, and just being very clear about what are the objectives and how we're going to divide and conquer and how we're going to measure everybody's work. And then at the same time, we're looking at all the schedules. We kind of found two spots. Every day we have like a daily stand-up, which is very common in kind of tech companies, but daily stand-up with all of us. We do a quick, 30-second update what we're working on. And then, which I think this is great, every day for us at 3 p.m., we have kind of 30 minutes of virtual social time, where we see kids and dogs, and it's like our coffee time. So definitely, again, maybe you cannot join every day, but it's a time to hang out with your colleagues and live with the situation. Everyone is on this; it's not just you. So yeah, I think this is working pretty well, because then people understand, hey, it's not just me at this situation. Everybody's living with the same situation. Everybody understands that maybe you have young kids, or maybe you don't, or maybe, you have a pet, or whatever your situation is, and just be mindful of that, and, very clear objectives, and I think we should not expect for, people to work in the same schedule, and and this is a different situation, and we just have to be mindful of
that. Okay. Now, yeah, Manuel.
I agree. Different schedules is basic for different people. So we adapt. We have present people and people who is working at home. So we manage depending on every situation. Every family has different necessities, so we adapt our staff to work on every week or every 15 days. So even they have to stay at home, and other people are able to be presential, and we understand the situations that prevent the burnout with the people. And I would say using humor is very important in this way, as a mature mechanism of defense. No? Sometimes it's difficult, but it's a way to interact. And we need time to introduce a sense of humor, not only with the patients, but with the staff, and with our families, of course. No?
Absolutely, yeah. So now, we've got like 10 minutes left. I would like to talk a bit about the healthcare professionals. So Manuel, you mentioned them before. So the mental health is very important for them. Like they're on the front line, they're getting a lot out of the situation. And I think there's also the psychologists, the psychiatrists like yourself. You are dealing with people on a regular basis who are not feeling well. So you're absorbing those feelings from those people. So what can we do to help those healthcare professionals and those like psychiatrists, psychologists?
Well, everybody, I would say that we are kind of analphabets in emotional intelligence. No? That's one of the difficulties. We are trying for a long time to introduce in the curriculum escolar managing emotions for people from 10 years old, from 16. So that has be one of the issues for continuing working. No? We know that, as we said before, projecting our emotions to the other people, it's part of the daily situation. No? In terms of accept our vulnerability for us is important, not only for the general people, but for the professionals too. We have difficulties in emotionally aspects, psychiatrists and psychologists and whoever. No? So the way to work is use our tools that we are teaching every day and try, as Roberto said, to teach to the other people through the appointments or demand that they have around us. I would say with the people who have very bad situations, who has lost family, that they are not being able to work and say goodbye, and the duelo, that's very, very bad situations that probably they will need in the near future treat the post-traumatic stress disorder that in some ways many people are going to have, like it happened in another catastrophes. Working with EMDR, different tools will be in the near future part of the working and the give solution and the needs that people are starting to have, and maybe working and understanding that the emotional intelligence is one of the most important in terms of the Howard Gardner issue, that different intelligence will be the time to take part, not for increase the healthcare resources in public and private, but in terms of mental health to work more and be able to understand that it's a main important for our society.
Okay. Pablo, maybe you want to add something because you mentioned that you are working with healthcare professionals. Can you tell us a bit more?
Yeah, totally. Well, Headspace, it's already being kind of recommended and referred by many healthcare professionals, not just in the US and in Europe, fully integrated in behavioral health settings, in primary care. And because of we work very close with healthcare professionals now, we're living in in kind of such tough situations, so that we kind of unlocked all the content we have, over 1,000 hours of content for, like I said, stress, anxiety, but also for dealing with pain, and content for your kids, and content for, so all the content that we develop, it's completely available for free to healthcare professionals, because we want to support healthcare professionals during this kind of challenging times. And then they also, even the more some of the skeptical ones now, they're trying meditation and other mindfulness techniques, and also if they benefit themselves and they see kind of the power of mindfulness and meditation, even the more skeptical ones, they're more likely then they also recommend it to patients, so patients can also benefit from the interventions. And I think it's working pretty good. And like I said, it's not for everybody, but we've seen, and we also have studies with not just with patient populations, but with healthcare professionals. So and yeah, and it's working, and I'm glad that we can support them. So we launched this initiative in the US. We launched it also in the NHS, and we're looking to expand this to other countries, since we need, of course, a verification system in place.
In how many languages is your platform or your app available?
It's in 5, so Spanish, English, German, French, and Portuguese.
Okay, great. Alberto, Ricardo, do you want to add something to that?
Yeah, I mean, not much to everything that's been said. We identified this particular population as a high risk for affective disorders during the pandemic for 2 reasons. The first one is exposure. They not only have to see firsthand the devastating effects of the virus, but also they are exposed to a higher viral load, so they're more likely to be infected. In Italy, the mortality rate in frontline healthcare workers is 12%. In Spain, it's about 10%. So it's really, really serious. And the other thing is lack of resources. This pandemic has caught most governments unprepared for it, and people are being sent to deal with this infection without personal protective equipment, and the majority of the task force are on very, very low salaries for the work that they do. So we thought that the combination of these elements will render them very, very vulnerable to emotional problems and adjustment disorders following the pandemic. And that's why we launched the Cuídate en Casa and the Stay Strong at Home campaign. This is a clinical network of psychologists offering 1,000 sessions for free to support the work that they do. So yeah, it's a highly vulnerable population. Yeah.
I mean, that's something's been amazing to see all the initiatives that popped up those past weeks and days to support the population, and yeah, I think that's really, really amazing. Okay, we've got just a few minutes. I'm gonna ask the last question to you, like a brief question. Manuel, you mentioned before that there may be some consequences to that situation. So if we look maybe a year from now, what can we do today to prepare for the future, to leave the confinement, to leave the crisis, and to be better prepared for the coming month?
Well, we don't know which situation we will have in the near future. So the first idea is to be able to understand that in the past we have many crises. So this is not one in terms of economics, and from 1992 and 12, so we can be prepared and to learn about what's going on. So see that preparing in terms of public funds, as we said before, for healthcare, it's one of the priorities maybe as a government, as our politics we have. And in terms of population, if we care more about ourselves and we introduce the tools, as well we were saying, like starting more connected with us through the socializing, through mindfulness, and be care with our emotional intelligence, maybe the first step to change the things. No? But be able to say that 40% of our happiness depend on us, and depend on us, understanding that the studies say that if you help somebody, your happiness increases if you help yourself. So that doesn't mean you don't have to help yourself, but you can connect much more, and understanding that it can happen. But if it happens, it don't have to be the worst scenario. But even in that situation, we can manage, and we try to work and to benefit of our experience.
Anyone else want to comment on that?
I think that we now have a first wave of this epidemic, in which we're gonna see a lot of casualties and a lot of lethality directly from the virus. But I think there's also at least 2 or 3 waves that are coming after this, which we're not considering now because we're so tangled up with what's happening that we're probably not preparing for what's coming. The second one is going to be people that suffer from serious conditions that are treatable if they are diagnosed early. For instance, people with colon cancers or breast cancers or other disorders that require early diagnosis and assertive treatment. These people are not being prioritized right now because the resources are directed towards treating people that are infected with COVID-19. So the delay in diagnosis and the delay in treatment will result in an increased mortality in this population. After this, we will be, as a society, submerged in, if not in a depression, certainly in a recession of the economy. And then people with chronic disorders will suffer. They will be deprioritized from health services. People with rheumatoid arthritis or with lupus or with multiple sclerosis, they will see the services that they receive in terms of social support can cut down and funding being redirected to hospitals to treat acute conditions. And then we have a fourth wave of mental illness. And as Manuel was saying earlier, this will affect people differently depending on which diagnostic category they are. So, for instance, people with pre-existing problems of anxiety and depression will see the problems increased, and the risk, of course, is suicide. People with psychotic disorders will suffer from quarantine particularly, and from persecutory delusions and delusions of control. Other people, like, for instance, people with catatonic psychosis or with eating disorders, for instance, might be affected, but not as badly. So I think healthcare services will have to go one by one through all the diagnostic categories and prepare for contingency plans for what's coming, because it will come. It is coming.
Aline, if you don't mind, however, I want to finish with one thing. The most important thing that I think we said today was said by Manuel: keep the sense of humor. So I have one of my best friends that said, now it's so exciting to go out and throw the garbage. It's like so exciting. So keep the sense of humor, because I think this is crucial during these times.
I have agree. And the sense of perspective as well. There is always a light at the end of the tunnel, and we're starting to get the first one. Just quickly, wanted to add on Ricardo and Manuel in terms of waves. A wave probably that's going to increase the mental health support need. It's probably going to be the impact on the economy. No matter what, it's a comment that wanted to be just before the one of Pablo. So now is made, and I just go back to let's keep the sense of humor.
Exactly.
A smile on our face, and we recover of this. That's for sure.
Yes, and there is hope. Absolutely, there is hope to win the situation and to prepare for any kind of situation we have demonstrated in the past, and we have the tools.
But mental health is very important, and we should really take that into consideration. If you are not feeling well, seek advice. SIOS are offering that platform where you can get 3 hours with psychologists. Treat Your Health Club also launched their initiative those past days. There's things out there. You can do mindfulness, you can do you do exercise. Just go on YouTube, do exercises. But it's very, very important. And laughing, keep joking, and everything is gonna be fine. So
thank you to your team.
Thank you very much for joining us today, for sharing your expertise on this very interesting topic. Thanks everybody for also joining the live event today, for asking questions. We'll be back next week. The next event will be on the 14th of April, the Tuesday. So we come back right after Easter. And this event will be in Spanish next time. And we do it. It's an event organized by Círculo Equestre, a club from here from Barcelona, in collaboration with Barcelona Health Hub. And we're going to talk about the impact of digital health in the actual sector. So we're going to have Novartis, DKV, like insurance company, Dr. Alia, and a doctor from a hospital here in Barcelona. So next week, 14th at 7 p.m. It's a bit later. Thank you very much for attending, everybody. Speak to you soon. Bye-bye.
Thank you so much, Lina.
Bye. Thank you.
Bye. Thank you.